Hey everyone, welcome to another P.A.D. test breakdown. We have Amanda with us, struggling with walking, wound on her foot. We have world-renowned RVT, Denise Levy, here from the San Francisco Bay Area, who's going to walk us through Amanda's story with her, how she actually performs a consult with these patients, all the questions she asks before she even gets to the testing. So, Denise, I'm going to leave it to you to get to the backstory and introduce Amanda.
Okay, thank you, Amanda. So I understand you have a wound, blister looking, near your great toe, in your foot. Um, and you're not diabetic, and you're a non-smoker, correct? Prior history of
Former.
smoking,
Former.
Mhm.
prior history, or are you smoking now?
Former.
Former. Okay. And you smoked more than 10 years?
Yeah.
Okay, so there's your risk factor. Um, and I've looked at your studies. Thank you for supplying us with those. And it looks like your left digit and left calf may have some disease. The 0.50 comes out as moderate on the scale. And then the mild to moderate in your calf. You can see that the numbers are less than 1. We compare the pressure in your leg to your arm. We assume your arm is normal. So that's how we get all these ratios. And anything that goes half, we know that there's some kind of blockage somewhere. What we have is the CT doesn't show any disease in your aorta, but it did not go into the iliacs as well.
Yeah, and we're only bringing up, just for those who are watching, we're only bringing up the ABI test right now. Amanda did
Correct.
supply quite a few tests from stress tests. I think, Amanda, you also had a heart catheterization. So obviously, when we talk about plaque buildup for peripheral artery disease, 3 in 5 people who suffer a heart attack have this PAD. So it's really important to know that the plaque can be systemic. And what was treated in your heart? Do you know which arteries they ended up treating?
None. Everything was all clear.
So you
Yeah.
did have, it may not have been clear, but they didn't have any significant narrowing in there that they felt they
Mhm.
needed to treat. Okay, that's
Right.
good.
Right.
And she had a low calcium score, cardiac as well,
Oh,
which
that's
is
good.
good.
Yeah.
Now,
Yeah.
the CT of your spine, there is stenosis, narrowing. So that can inhibit your feeling in your feet and your walking. So that's why I was asking, how much do you walk per day?
Uh, As little as possible because it is
Okay,
excruciating.
okay, okay.
Um, uh, if it was walking to improve claudication and things like that, 100%. I'm on it. I would love to do it, but just a simple leaf blowing my driveway caused the wound on my foot, and I'm kind of off balance, wobbly on my feet,
Uh-huh,
not sure on
uh-huh,
my feet. So
okay. Yeah, so I think a wound care evaluation would be great for you. The venous testing was positive at the groin. But if you're not having symptoms, I would kind of shy away from that um, because it doesn't sound like you have a venous ulcer on that leg.
But I'm
So that's
curious,
basic.
which leg is it on? You said right digit?
It's the left. See
Oh,
where it
it's the
says
left.
0.50,
Yeah.
and then in the calf it goes to 8.7 in the calf, and
Right, which
it's
isn't
non
bad. That's
and it was non-compressible in the thigh.
Oh, okay.
Um,
Oh, I'm seeing that now. Okay,
yeah,
that's right up here.
yeah.
Oh, interesting.
But
Okay, that's
what we don't have is a scan. So a
right.
duplex scan would give us more information about the inflow, since with the high thigh is what we call non-compressible, you can't compress a pipe or an artery that's calcified.
Yeah.
You
There,
can't compress it with the blood pressure. And did it hurt a lot when they brought out, it must have hurt a lot when they inflated the cuff
as
in your
it went
thigh.
up, yes. And I
Yeah.
do have pain in my groin, and it kind of wraps around my thigh.
Uh-huh.
Mm.
Okay. So, but the low thigh is normal at 133. The other low thigh is 60. It might have been a little elevated with some calcium possibly.
So you
But
have
you're,
non-compressible at the top, and
yeah,
it looks like things are more normal, going down, but yet she has a wound that she doesn't think is healing. Could you argue that, collateral vessels are maybe the profunda might be helping with feeding the below the knee um vessels and at least getting something down there?
right. Yeah. I wouldn't, none of this is moderate to severe. None of this. This is all
Even
mild to moderate.
even the
And
non-compressible though up in the thigh?
well, sometimes it's difficult to say if it was non-compressible or did the um, cuff go down a little further? Did they not try it twice? I'm usually a little leery of non-compressible high thigh.
Okay.
But a duplex scan would definitely be very beneficial to look at the calf arteries and what's feeding your foot. That would be my recommendation.
Perfect. Well, thank you. Do you have any questions, Amanda, for our VT Denise Levy before we jump off?
What
Was
is
that helpful?
very, very helpful. I cannot thank you guys enough. I have been, it's hard. You get down. When does this
Yeah.
end? Or I just need whatever the next step towards light at the tunnel. So I appreciate this. This could not have come at a better time for me, physically and mentally. What does non-compressible mean?
Like I said, if you took a pipe, like a metal pipe, you try to squeeze it, you can't compress it, right?
Hmm.
But if you take like some silicon tubing and squeeze it, it squeezes very easily, and that's the way it should be. If there's calcium in the artery, it's like a pipe. It's very
Okay.
hard. All the walls are with calcium, so you cannot compress that artery to get a pressure out of it.
Okay.
Okay. So
Strange.
that's
Yeah.
why they put on there, it's greater than 250 pressure.
And what does
Okay.
that mean?
So
That's
that means that the artery should compress at 115 because your arm is 115. You see?
Mhm.
Hmm.
So that's how we get the ratios is we compare all your artery pressures to your arm because we assume your arm is normal. And it's not
Okay.
like comparing with a sphygmometer, like a machine that they blow up in the office when medical, they take your blood pressure. This
Yeah.
does not do systole diastole. This only does systolic pressure. So this is the resting pressure of your arteries as you go down. And if there's calcium, you can't compress it. That's why it says 255, 254, non-compressible. Okay. So I
Okay.
don't
how
know
long?
if it's a technical issue with the non-compressible or is it true calcium?
How
Okay.
long were you having pain, and how many times did you have to complain to your primary care before you ended up having someone do something and get that ABI test?
Yeah. So as things progressed, I started to try to walk back. When did I first complain about this? When did I first mention it to my husband or my family? So I started looking back, and I did this about a year ago, and found that in late like October or November of 2022, after I had COVID, and I kept testing positive like 3 times in a row for COVID, and then suddenly this pain and numbness, tingling started. And by 2023, like summer of 2023, I could take one step, maybe, and I would have to stop. The pain from my groin down would be so bad. Um, and so beginning of 20, so at 20, late 22, I noticed the pain. Um, Beginning of 23, I first went to the doctor, and they x-rayed my feet and said, oh, everything looks fine. My next visit was a few months later at the pain doctor, and they x-rayed my hips and said, you might have some arthritis, but everything looks fine. And those appointments, my primary, can you check me for gout? Can you run some labs? I don't know what's going on here. I have this pain when I walk, and it even hurts me when I go to sleep at night. When I lay down, when I sit, I can feel the pain. It just kept progressing. And so at least once a month, I would have a doctor appointment and no answers. And by 2024, I went to my primary walk-in clinic, and it was a different gal. And she didn't think I needed to be tested for gout because both, feet were hurting. But she wanted me to get checked at cardiovascular, a local cardiovascular place. And they did the ABI and sent that back to my doctor. And I got a call from my primary's nurse that said, oh, everything looks great. But the pain persisted. And so I went back again, and the doctor looked and said, well, let me look at the results, because I said, this is still continuing. And so she pulled the report up from cardiovascular, from the ABI that you're looking at now. And she said, this absolutely is not normal, and I would need you to have some further testing. I want to refer you back to CVM. So rather than going to cardiovascular just for the ABI, now she actually put in a referral for me to, I don't know, become their patient and order more tests. And from that came all the other tests, and they wanted to look at my heart before offering anything for my legs. So that was pretty discouraging, because now this whole time, lots of copays. My mobility is awful. I have a young child. My husband works. It is a lot for a family to continue like this for a couple of years, only to be worse now, you know? I saw this last night, and I'm like, oh my gosh, please. I would love to join.
Yeah.
But I'm glad Denise is well. Too often we hear kind of another side of the story where they only look at the legs, they get myopic, and it turns out that they have AFib or valvular issues or a thoracic aneurysm, that you have clots getting thrown, down your legs. And so they go and they band-aid the legs, they roto-root the legs, and then it keeps clotting and clotting, and it becomes this crazy revolving door of treatments that is never resolved. And at least, I know they didn't solve, but at least we ruled out, the AFib, the valvular issues, and now we're
Yes.
going to be focusing more on calcium. Being a former smoker is being the primary risk factor, as Denise said. How long ago did you quit smoking?
Um, Beginning of 24, because I had to have my colon resected.
Okay.
And I have bowel loops now coming out of like my belly button. I
Hernia.
just found this out last week. Yeah.
Yeah.
So it makes me wonder about the iliac and why they didn't look at that. They did offer, after the cath, the heart cath, they offered me to have like a foam put in my thigh, but said that they wouldn't necessarily recommend it for me because it wouldn't do anything for my foot, and they couldn't go down. They don't work in like smaller veins. And that was the
Okay, so
best
they're
they could
talking
do.
venous. They're talking venous. And what did her
Uh,
venous scan say, Denise?
She does have reflux at both junctions.
Okay.
But most, if she doesn't have a venous wound or venous ulcer, why touch it? You know, I would save that greater saphenous for maybe an arterial situation that could come up
Yeah.
later in life.
Yeah. We just
Um,
Mhm.
had
I,
that situation
I
where
don't,
they sealed
think
off
it's
her
good.
veins.
I don't think it's, well, I personally look at the whole patient. And
Yeah.
if there's more disease arterial than venous, why treat the vein when you can take away a perfectly good conduit if you ever needed a bypass in your leg, you know?
Yeah, we just had
Um,
that situation, Denise, with another patient, and she has literally no veins to to do a bypass now. It has to
right,
be synthetic. Not so
yeah.
that's something to definitely be aware of. And I'm
She
glad if
doesn't
anyone's
have
watching right now to pay
yeah,
attention to that.
yeah. You don't have varicose veins, do you, Amanda?
No, I have one on the outer right side of my thigh. Very, very, very tiny.
Yeah, that would be an anterior accessory, so, um, no, I think going to this wound care will open up, they'll do more testing, they'll do a scan, most likely. And maybe aorta iliac would be good to know what the inflow is doing.
Guaranteed.
But the scan, they'll do possibly aorta iliac, which will be
Yeah.
fasting most likely. And then they will do the entire leg from groin to ankle.
And that's an
Yeah.
important point in case you're not told. Denise brings up a very important point about when you do go for that aortoiliac testing. If it is aortoiliac testing, they should do it, especially having been a smoker at some point, because most smokers, you have the diabetics that have more below the knee disease. And then, former smokers ended up with more upper, so aorta, iliac, common femoral in the bendy spot. I call it the sit artery because it bends when you sit. And then in the
Yes.
thighs and sometimes down to the popliteal. So, just say that one more time, Denise. If she's getting that, and if they specifically say it's aortoiliac as well, fast. You need to fast. Why?
Oh, it's just to calm the bowel so that the ultrasound has to go through the bowel to get to the artery. That's usually the only reason, is to slow down the peristalsis for when
I'm
you
very
have that.
slow. I
Yeah.
have a motility very, very slow. So would it be best for my bowel to be more empty?
Oh, don't worry about it. They'll give you the prep.
Or
Yeah,
They'll
just
tell you what
so,
to do. Yeah.
okay.
especially if you do
Yeah.
tell them that you've had the colon resection, and there will be
Yeah.
specific instructions. But if they don't, this is great because Denise is making sure
Yes.
that you do mention those. If they don't ask you, you do need to mention it and say, hey, I know that there
Yeah.
is, if especially if you're doing aortoiliac, my colon resection and how things move might impact it. So how can I best prepare for that?
Yeah.
Perfect. Yes.
Yeah.
Yeah.
Hmm.
So Amanda, definitely thank you so much for being here.
Thank
I've
you.
actually sent a message already to a doctor that will follow up with you in case you're interested. So that you can, continue with the testing, and you can seek multiple opinions. But thank you again
Thank
to
you.
Denise for all your time. And if you have results you want reviewed by our world-renowned RVT Denise Levy, go ahead and email info@padhelp.org. And don't forget to like the video and subscribe to our channel for more great content.